development of safe, effective COVID vaccines in record time was an extraordinary triumph of science. At the same time, the other side of that triumph is clear in our struggle to vaccinate the country and the world with speed and equity. There's a saying in public health, vaccines don't save lives, vaccinations do. And we're really seeing that contrast matter between breakthrough in discovery and breakdown in delivery. We're in a golden age of innovation, but we've got to match our achievements in technology and medicine with the same sort of progress in access and affordability, in law and policy, if we're going to translate all of that innovation into better health and better lives for people around the world. This is the domain of health policy. We use the tools of quantitative and social sciences to drive evidence-based solutions at population scale, and thinking especially about those who are too often left behind. Health policy is the bridge that can lift breakthroughs over the chasm of breakdown. Stanford Medicine just this month has launched a new Department of Health Policy to unite and catalyze university-wide collaboration in this area. And what a moment this is for health policy at center stage during this pandemic. For me, a sign of that visibility is that my teenage daughters actually have some idea about what I do for a living now. But more fundamentally, COVID reminds us that health policy touches so many decisions that affect us all. I remember really well that day in early March 2020, when I knew that I would be putting aside whatever I could to dive into COVID policy work. Because I had some skills that could be useful in a once-in-a-century public health emergency, and because this is what we do in health policy. And I remember the days that followed as faculty gathered together and students came over to ask, what can I do? How can I help? Like never before, the need for health policy analysis was everywhere you looked, and we knew we had to answer that call. So we answered it by absorbing the flood of new data, by connecting the dots with modeling and forecasting, working directly with policymakers to try to tie all of this together and translate it into the guidance that they needed for urgent action. Here's what health policy analysis looks like at the speed of COVID. On Friday afternoon, our team finishes up our latest analysis on how we might speed up the allocation of vaccines to the hardest hit neighborhoods to try to address disparities. The next Monday, the student who led that work is presenting our recommendations in a briefing with the leaders of the health department and the governor's office. And the following Wednesday, we're reading about a new allocation policy in the papers. And the day after that, somebody's really mad about the policy. But health policy is more than emergency response. It's how we prepare for and ideally prevent the next health crisis. It's the problems of aging world, cancer, heart disease, dementia. It's the other epidemics, obesity and the opioid use crisis and gun violence. We will turn the page on this pandemic. And when we do, there'll still be plenty of work left to do in health policy. We're ready to tackle these problems on a big stage, thinking beyond decisions that affect health now, towards guiding strategic investments that can shape health for decades to come. Stanford is a world leader in creating solutions for health challenges. We also have the expertise to understand where those solutions fit in health systems, to forecast the big trends in health that'll matter, and to think in systematic, data-driven ways about the decisions and the events that can drive those trends in one direction or another. We want to connect those dots to devise an explicit roadmap to prioritize innovations that have the greatest potential to improve population health and reduce disparities. Take, for example, Alzheimer's. Where might we look for the biggest health returns from new discoveries in diagnostics or prevention or treatment? Thinking across diseases, how would those impacts compare to progress we might make against diabetes or childhood cancer or mental illness? And in order to avoid breakdowns while we cultivate breakthroughs, where might we look for innovations in delivery and financing and data systems to make the technologies we develop accessible and affordable to everybody? We have all the elements at Stanford to answer these questions. We want to bring those elements together in a new initiative called the Global Health Strategy Lab. With appropriate support, health policy research at Stanford can roll out a blueprint for innovation that delivers impact to transform human health over our life.